Dear students, my name is Jordan Simeonov, and I would like to present an evaluation of the pesticides risk for children. In terms of exposure to pesticides, infants and young children constitute a particular population of concern because of their great susceptibility to such exposure due to the behavioral, anatomical, and metabolic reasons. Toxicological modes of action include effects on nervous system maturation, endocrine disruption, and the influence of early life exposures on the development of disease later in life. The routes of penetration of pesticides in children's bodies induce much stronger adverse effects because the exposure is proportional to the child body and is calculated on a body weight basis. The dependence of several key exposure variables on the age of children, such as body weight, water intake, breathing rate, skin surface area, total vegetable intake, and total dairy intake, is presented in a table. The physiologically based susceptibilities, such as the organ size changes, gastrointestinal system acidity, body water or body fat, the skin permeability, the development of the blood-brain barrier, are presented also. The metabolism-based susceptibilities, or the children's potentially increased susceptibility related to smaller metabolic capacity of the child's liver, are discussed. This is the title page for presentations of the Erasmus project ToxOR, Learning Toxicology through Open Educational Resources. And now let us go back on the topic and include some more detail. Evaluation of the pesticides risk for children. Infants and young children constitute a particular population of concern in terms of exposure to pesticides. For reasons of behavioral, anatomical, and metabolic character, children may have greater susceptibility to the adverse effects of pesticide exposure. The toxicological modes of action include effects on nervous system maturation, endocrine disruption, and the influence of early life exposures on development of diseases later in life. Children used to play in a potentially contaminated media. Exposure-related susceptibilities. Exposure is a key factor in determining health risks. Even the most inherently toxic chemical will pose a risk unless there is sufficient exposure. Many factors which result in an increased potential for exposure during childhood are readily apparent, particularly as regards the oral route. Children between the ages of 2 and 6 crawl on the ground, where they may pick up particles of soil, dust, or chemical residues. In addition to soil and dust ingestion, children also exhibit a greater intake of food and water than adults. Water intakes of infants and young children are about double that of an adult on a body weight basis, and intakes of particular food categories can be many times higher. Children have a more restricted and repetitive diet, that is juice rather than water, only fish sticks, certain vegetables, which lead to different level of chemical exposure compared to a typical adult. Although the oral exposure pathway usually dominates children's exposure, other pathways may be important in certain cases. Children have an inhalation rate that is proportionally greater for their body size compared to an adult, and thus on a body weight basis will have higher exposures. The same applies to dermal exposure because the child has a larger surface area when scaled to total body mass. The skin surface area per kilogram of body weight of a young child is approximately 60% greater than that of an adult. This is a table of the age dependence of key exposure variables. Infants and neonates have a unique source of exposure. This is the breast milk or the baby formula, which they consume at a very high rate relative to their body weight. Maternal milk may involve the transfer of lipophilic toxicants, like DDT for example, from mother to child. The use of baby formula could be associated with increased exposure to contaminated water supply. Physiologically based susceptibilities. The moment of birth initiates dramatic changes in physiology. From birth to the late teens, the child's body grows and matures, becoming increasingly adult-like. The pattern of growth and development during childhood varies among different organ systems. Organ size changes. Patterns of organ growth during childhood are highly organ-specific. Babies have brains much larger in size relative to their body compared to adults. Based on brain size, children experience higher doses of a chemical of interest. Gastrointestinal system acidity. Stomach pH can have significant effects on the absorption of pesticides that are weak acids or bases. Body water and body fat. Body water and body fat percentages determine the disruption of chemicals in the body. Body water decreases consistently with age from about 74% in the full-term neonate to approximately 60% in the adult. Skin permeability. In adults, the stratum corneum, a layer of dead highly keratinized cells on the skin surface, constitutes a barrier to dermal penetration of many compounds. Blood-brain barrier. The blood-brain barrier is a multi-component structure that prevents harmful substances from entering the brain from the blood supply. The blood-brain barrier in human infants is relatively undeveloped and displays greater permeability to drugs and other exogenous compounds until about 4 months of age. Developing tissues. The cells of many tissues in the infant and young child are undergoing rapid division and maturations. These are the cells of the central nervous system, the reproductive organs, and the immune system. These highly active cells are susceptible to chemical insult, and if eliminated or damaged early in life, may leave the individual with diminished capacity later in life. Elimination. Chemicals are cleared from the body primarily via either the urine or feces. It's the biliary excretion. Metabolism-based susceptibilities. Another important component of child's potentially increased susceptibility relates to metabolic capacity. At birth, many, although not all, of the metabolic enzymes in the liver have much less capacity compared to the adult. Thus, infants may metabolize many chemicals less efficiently than adults, meaning the chemicals are much more slowly eliminated and consequently may accumulate to higher levels. This may represent an adverse situation for chemicals which exert a direct toxic effect in the body. Toxicological modes of action of particular concerns for children's risk. Effects on nervous system maturation. The development of the human brain is a remarkable and carefully coordinated process. Over the course of nervous system development, over 100 billion neurons in the brain must find their proper location and form connections with their neighbors. Nerve fibers must become insulated with myelin in order to transmit signals with proper speed, and neurons must develop the proper machinery for producing, secreting, and recycling the appropriate neurotransmitters. Endocrine disruption. The disruption of the endocrine system from chemical exposures is another area of particular concern for children's health risks. Through the secretion of hormones, the endocrine system controls body's most important processes, as thermoregulation, energy production, blood sugar concentrations, reproductive function, immune response. Proper functioning of the endocrine system is also critical for both prenatal and postnatal development. Organic chemicals, such as pesticides, can mimic or interfere with the function of endogenous hormones, thus leading to improper signaling. Fetal basis of adult disease. Exposures in utero or in early childhood can predispose an individual to disease that emerges later in life. The early life exposures are causative agents in Parkinson's disease. The non-renewable dopamine producing cells in brain are lost in PD, typically later in life, and symptoms of PD as the tremor and difficulty in gait manifest. A number of epidemiology studies associate early life pesticide exposures to PD and various infections and brain injury. At the end of the presentation is the closing page of the Toxoer project, where you can see the logos of the participating educational institutions from 7 European countries.